back, everyone. As the U.S. tries to get a handle on the COVID-19 outbreak, cases continue to spike across the country. Joining us live now to talk about the rapid rise in infections is Dr. Rob Danoff of Jefferson Health. Good morning, Dr. Rob.
Good morning. How are you?
Doing well, Dr. Rob. So some cases now are being traced to parties and larger gatherings, which people have been warned not to do. Are you seeing some more young cases in young people and young adults?
Oh, absolutely. Matter of fact, one of the higher percentage rates are between 19 and 24 years of age. We are tracing this back to some parties or large gatherings at the beach at the Jersey Shore, and then they're coming back here. A lot of these young people are there without facial coverings or close together, and I don't think people realize that even if you look well, when you are that close to somebody, especially in a closed environment, you can spread this very easily, and we're seeing case percentages positives picking up for sure in this area.
And when these young people are testing positive, do you think they're surprised?
Well, yeah, some of the people that I've met or tested, they're like, huh? Yeah, they are, because they said, I feel fine. But here's the thing, a lot of young people may feel fine, they may get symptoms. We've seen some very sick young people, but the young people maybe don't realize that all you young people out there, that you can spread this to other people, maybe people who are being treated for cancer or people over 65 who are very vulnerable to getting extremely sick from this virus by just you being close to them. So you may be well, but if you don't wear a face covering, you may spread this disease to other people.
So, Dr. Rob, do you think people are getting a false sense of security when gathering, even in small groups with family and friends? I'm noticing a lot of these quarantine bubbles where people are only socializing with a very limited number of people.
Yeah, and the quarantine bubbles are actually a good idea, but as long as that bubble stays intact, what's happening is, as you're a family unit, if your family unit kind of bubbles together and you don't keep with outside people, that's one thing. But once you introduce other people outside your family or friends who have been with other people, then you're introducing a potential spreader to your inner circle. So it's really important that once you have outside members come into your circle, everyone there needs to wear facial coverings. That's been proven to decrease the risk of getting COVID-19.
I have to tell you, Dr. Rob, I'm looking at friends on social media and they're all close together, no masks, and I'm like, well, I'm avoiding that person, I'm avoiding this person. I mean, It just doesn't seem like people are getting the message.
No, just the other day I was out and about and I saw a fair amount of people not wearing it. And you know what? My mask protects you, your mask protects me. Look, everyone, we are waiting for a vaccine. It's many months off. We don't even know if it's going to work. But what we do know that works is each of us wearing a facial covering. Coronavirus 2019 is highly spreadable to other people just by talking, being within 6 feet of each other without this facial covering. So a lot more people will get sick. And the cold and flu season is coming up soon.
Yeah.
So we need to take extra precautions. Please, everyone, wear facial coverings when you're out and about, or especially in closed environments around other people.
Well, speaking of closed environments, more than a dozen members of the Miami Marlins tested positive for COVID-19 after the series with the Phillies. So this shows how contagious this can be.
Yeah, so Major League Baseball is going to have a problem. That's basically community spread within a team. All those members of the team that are positive they're going to be isolated for 14 days, the positive ones. Anybody near there, and here's the flaw with testing, you can be tested the same day or the day after exposure and still be negative, but yet you may have the virus. Major League Baseball is testing people every other day. What does that mean? It means that some people with infection can still be out there playing and then spread it to other people. And so this is going to be an ongoing problem. Yesterday, I saw a shortstop next to a person who's on second base. One person was wearing a facial covering, the other one wasn't. Major League Baseball's going to have a problem. This is just the tip of the iceberg. There's going to be a lot more cases.
So, Dr. Rob, a few weeks ago, we seemed to be getting pretty good with the testing. Results were coming in rather quickly. Now we're starting to see more and more delays. What are you seeing on your end?
Well, fortunately, and you're right, Jim, there are some areas where there's a lot of delays in getting the reports. In our area, we're still pretty good with getting results within 48 hours or so, but it's not everyone. And that's the problem. So it's very inconsistent. Some people are still having some problem getting supplies or getting the results back. So I would just make sure whenever you go for testing, just ask them, what can I expect? When can I expect to get the results? And everyone, please, if you're going for a test, it means that you probably were at risk. Once you are tested, stay home until you get those results. We have people saying, well, I just might as well go outside till I get the results. No, no, no.
Yeah.
If we're testing you, it means that there's a concern, so you need to quarantine until you hear from us, whether you're positive or not. And last thing, Jim, a lot of people say, what do I do if I'm exposed to somebody? If you're exposed with someone, that means you need to quarantine for 14 days. And so just in case your symptoms develop, you know, and a significant exposure, and please everyone remember this, if you're within 6 feet of somebody for 15 minutes or more who has that virus, you're at risk. You need to quarantine for 14 days.
As always, Dr. Rob, great advice. We appreciate it. Please continue to stay safe and healthy.
You too. Be well, everyone.
Thank you, Dr. Rob. Turning to